COVID-19 pandemic, emergency departments across the nation continue to experience extremely high patient volumes. That's why the team at community medical centers is constantly looking for ways to improve patient experience and better prepare patients and their families for when they go home.
I think we all had this false sense of security that when COVID ended, that we were going to see some sort of reprieve, and we haven't. The emergency departments are just as busy, if not busier, than they were during COVID.
That's why community is focused on continuing to evaluate and improve what's called patient throughput.
It's essentially the movement of the patient from the beginning of their hospitalization all the way until we discharge them.
We're doing really a deep dive into our length of stay. Why are patients staying here longer than they need to?
Making sure patients are discharged in a timely manner not only benefits them in their healing journey, but also in their aftercare.
Things like getting authorizations in a timely manner, being able to arrange aftercare appointments for patients, all of the things that patients need to be able to discharge safely from the hospital.
Because we know optimal healing doesn't really happen in the hospital. It happens upon discharge, particularly when patients go home.
Improving throughput and coordination of care is a priority for all community medical center campuses and their teams.
It's nursing, it's the physicians, it's the case management teams, all talking about the patients and what their needs will be to be able to move them through the system most efficiently.
And for patients who need additional care after their stay in the hospital, a new transitional department is being implemented.
When patients are discharged right now, we can't write them a prescription for more than 30 days. So patients discharged from the hospital, and sometimes it takes them longer than 30 days to see a primary care physician or a specialist. So what happens if it goes beyond those 30 days and patients might need follow-up labs or follow-up x-rays? So how might we develop a unit on an outpatient basis where we can capture this small group of patients?
Increasing these efficiencies across the health system also grants each hospital the ability to provide beds to care for patients in the need of emergency care.
We really are trying to preserve that space for patients who need emergent care. Patients aren't getting preventative care, right? They're not going to get blood work, they're not getting mammograms or yearly exams. They're using our emergency departments as primary care.
And although these changes won't happen overnight, the team at Community is committed to providing the best experience possible for each patient.
If patients will allow you to, families truly need to be involved in the discharge plan. Bringing, those extra ears and the extra hands on deck to be able to help with the patient when they discharge from the hospital, to know and understand all of the resources that we're trying to provide them, to just be a second hand in their care after they leave the hospital is going to make sure that they're not going to have to come back.